is Linda Kearney. I am the lead Parkinson's nurse service for the Parkinson's nurses in NHS Fife. My role is primarily, looking after the people with Parkinson's and leading the team and being dynamic with services. A multidisciplinary team consists of a range of allied health professionals. It includes speech and language therapy, occupational therapy, physiotherapy, specialist nurses, consultants, dietitians, a vast range of any of the healthcare professionals that are involved within the team. So the benefit that I've seen for patients coming through this multidisciplinary clinic is we have baseline measures of these. We take these patients on their journey. We are there to support them and to identify their needs as their Parkinson's disease progresses. We are with them from early on to identify that. Professionally, the benefit, hopefully we're leading the way and we're encouraging the rest of Fife to follow. We've already had conversations and we are asking other allied healthcare professionals throughout Fife to come join us and hopefully we can build on what we already offer so that we can take it to the patient rather than having right now resources are a bit restricted and we bring the patient to us. So to develop that, we take this to the Fife support group. We advertise ourselves as truly multidisciplinary professionals, engaging with each other and driving services forward to ultimately improve the quality of life of people with Parkinson's disease. I think the benefit for multidisciplinary team working is to provide benefit for both the professional and most importantly to the patient. We have a new diagnosis multidisciplinary clinic for patients who have a new diagnosis of Parkinson's disease. They come along to clinic and they are seen by specialist nurses, consultants, they are seen by physiotherapy, occupational therapy and speech and language therapy. So the team that we have for the new diagnosis clinic came from several years ago from a vision that we all shared. We all worked together within the day hospital setting and we all had a vision that we early recognised that people with Parkinson's, whilst they were able to have access to these clinics, they didn't have timely access to these kind of clinics, and that from diagnosis this was something that became difficult to access. So we worked kind of behind the scenes for years because we first started the clinic in 2017, which was a very first for us. So we piloted that clinic. We were super excited to offer this to people with Parkinson's in Fife. We offer that clinic to all patients who are diagnosed, whatever age they are, have their diagnosis. So we started that clinic and it's been running really successfully ever since then. I think also personally for me, the one thing that led us to that multidisciplinary clinic was relationships within our team. Having that vision and sharing that vision and that passion for people with Parkinson's, I think that was probably one of the things that took us to that clinic. Resources can be really difficult to access across rural areas, across even within the same health board, other areas can struggle to provide resources. So I think the relationship and the determination in this instance, within NHS Fife, I think the determination of the whole multidisciplinary team led us to that very successful clinic. This clinic demonstrates how we can all save time with these types of clinics. Patients who are diagnosed with Parkinson's disease have access to all these multidisciplinary benefits from early diagnosis, but bringing healthcare professionals into one team, directly providing that care can save for the patient, it can save time for patients, it can save numerous appointments, numerous attendances to other allied healthcare professionals and bring a team together to work as a team, to share that teamwork and to share that patient's journey and for time and for cost effectiveness within the organisation is a benefit, but ultimately the patient can have one appointment in a new diagnosis multidisciplinary clinic as opposed to 4-5 different appointments where they have to rely on family carers to attend all these appointments.